So this one is the last one of the series, and probably thank goodness for all of you not to keep watching me. But this one's called TMI, Too Much Information. So just as all of you go through so much in your body dailies, in the dailies of too much information, TMI, that people around you could feel that way. Yes, you do go through a lot of harsh judgment to the point of even medical trauma and medical PTSD can develop where you feel derailed and just traumatized. You can imagine with the autonomic nervous system being everywhere in the body, brains, nerves, gut, skin, endocrine, immune, every part of the body. So dizzy, lightheaded, brain fog, weakness, dizzy, gut dysfunction, dizzy, lightheaded, woozy, skin color changes, digestion, off allergies. That it's everywhere. It's global. So people around you might not understand it. It does take often. It feels expertise to get you. So much information is just TMI, and people will often use what's in their toolbox to try to get you for better or worse, and that can lead you render to a very vulnerable role place. So TMI is a real concept. So some helpful tips are this, and this is not to be simplistic or crude or raw or reductive or crass to any of you. If this seems in this video too simplistic, so I apologize if it does. One is for your medical team, including the nurses, your therapists, psychologists, counselors, your medical providers, the POTS manual, Cleveland Clinic, POTS manual, Google it, internet search it. It's right there, right there. And it's a great resource to just give to people. You're not the ambassador to explain it. And it's 7 pages. People can read it in 2 minutes and or read it over again. Put it in your medical record. It's a page in the last page for your medical team as a resource to find. Two, for your medical team, in many of your appointment notes with us, if you're a patient of ours, there are things in the note for Dear Provider for tools in toolbox. Three is Dysautonomia International is a spectacular resource for local medical team and for you to find resources and tips in your area. For people in your daily life, it can be very hard for them to get you. So that's why we have videos and playlists for I know someone who has POTS, or I love someone with POTS, just so they can understand you and get you. So there is, you don't have to be the one to explain it. Let them listen. They can listen to it in the car. Make this video like a podcast. Just listen. Just listen. Listen, 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 listen. So just listen. And they can just do it that way. And it's 5 minutes. You can listen with them or by themselves. You're not the ambassador of information. It will help them at least have an organization, some experience. So lastly, in medical appointments, you have many symptoms and many of you have lost people believing you or don't know what's important for information to bring when such global body symptoms and your life is derailed by just how you feel. Here's some important information. Healthcare is overwhelmed with too much information. Medical providers, nurses, healthcare delivery professionals have too much to do with pharmacies, insurances, training people, research, education, other patients. You want to be efficient with time. Time is the most valuable commodity. So here's some very important aspect is medical records. People really, when I talk to people, don't have time to review extensive records. Bring the most important, most recent note of your last main medical provider or two, and the most important tests to your diagnosis. Binders can be overwhelming for people. Excessive MRI disc that are not important, don't have a disease-defining diagnosis. If somebody wants it, they'll ask for it. So really just the important last note of the one or two specialists and the most diagnostic test that gives you your diagnosis. Showing labs on your cell phone or computer open just really delays the visit. Print it or have it there. Just so overwhelming amount of paper doesn't help. You can have a binder in a bag, but really those 5 or 7 pages, 10 at most, the most important information present um, is really what's needed. Have your medication list ready, how you take it daily, printed and available. The other aspect is think about what is your most important question. You might have global symptoms. You might not know what is the important thing to ask, but really think about what you need to address. Is it dizziness? Is your dizziness worse, better, or standing? Does it get relieved laying down? That's what I want to work on. What's your most encompassing worst issue of the week? They can work on that and maybe find a way of solution base that with you. Or I need to get handicapped parking. That could be a goal and a visit, move things forward together. There's so much to work on. If you do 20 things at once, you're not going to work on anything. It's like a house. If your house, buy a new house, and you just say there's 20 things to work on, you're not going to do anything unless you work on one thing at a time. So it's really the same concept. The last thing is also like the My Chart or patient portal email. Every time you send a long message, it forces a review of everything in the past without really moving care forward. So long messages really forces a detailed review of not really forcing care into the future. Think about what am I really sending? Does it make sense? Some of the best messages are people who write things in one or two sentences and say, what so I'm really trying to say? Or can I really just bring us forward in the next appointment? Um, we know appointments are valuable and challenging, especially in super specialists. This also I'm talking about with your other providers. Um, People are really trying to see patients. And remember, when you are in an appointment, other monitor messages are being sent. So if people are my charting, it interferes with patients being seen. The more monitor messages are occurring, the less appointments that can happen for other patients. There's actually a concept that the more monitor messages that are sent reduces ability to add patients to the schedule. So we are in a sort of time now that excessive monitor messaging is reducing the ability to see patients or call patients or be with patients. So be mindful of that concept, but really think about the message. What am I really trying to do? What's this about? And how can I be most effective? One, two, or three sentences. And what am I really trying to say? And that just like texting or a cell phone text or email, um, what can I really do in often like a text message, the intent or content that what I'm being received back as a patient might not mean the person does not care about me. A lot can be lost by text and email in terms of heartfelt intention. So that's information about TMI. You have a very complex disorder with lots of symptoms and really trying to be efficient and knowing that TMI is happening in all aspects and just trying to navigate this for you. So we respect you greatly and the last of the series. And if you listen to it again as a video or as a podcast, thank you so much.